I wanted to get his reflections to start with on what he'd seen.
I think for me, I had been preparing all of my clinical life, and 30 years of it spent in war zones in the Middle East, from Palestine to Yemen to Iraq and Syria.
You specialise in blast injuries, is that right?
So, as a plastic and reconstructive surgeon, both academically and clinically, I developed an expertise in the management of war wounds and the reconstruction of war wounds. Both my research and the books that I had written are on war injuries. And having worked in multiple war zones, my clinical experience. And I think it's like you've lived your life dealing with floods, and then you see a tsunami. And that's how unprepared you are. You can recognize parts of it, but the scale completely overwhelms you.
And one of the things you said is that you saw children with white phosphorus wounds.
So I had seen white phosphorus burns in Gaza during the 2009 war, and I was very familiar with very distinctive injury patterns. Phosphorus is a chemical burn, and so what it does is it burrs into the body rather than spread laterally as thermal burns do. And so suddenly we started, when the land invasion started, we started seeing these, initially on a 13-year-old boy and his father from the north. And then when the Israeli tanks reached the beach camp, the refugee camp in Gaza City, we started seeing many more patients with very distinctive phosphorus burns injuries.
And this is, of course, a very, very important issue. Israel insists it hasn't used white phosphorus. So can I ask you, are you absolutely certain these are a very distinctive form of wound that you wouldn't be mistaken about?
Absolutely. So the phosphorus will continue to burn into the body. And your job as a surgeon is to try to cut the burned tissue out. And what you end up with are cores of tissue that go all the way to the bone. And so the dad had burns into and part of his ribs, and the child had multiple burns all the way in his back down to the bone.
Wow. So that is a very, very serious thing for Israel to confront at some point.
Absolutely.
You were in these hospitals, and as you know, the Israelis have said that particularly Al-Shifa had a Hamas center underneath it, in tunnels and so forth. I think you arrived a couple of days there after allegedly people who'd been abducted, taken by Hamas, were in the hospital. Did you see any sign at all of Hamas where you were there?
There wasn't. When I got there, Shifa started turning into this shanty town of over 50,000 internally displaced. It had 600 beds. By the middle of the war, there were over 2,000 wounded. And I would go, as supplies dwindled, I would start my day really foraging for supplies. And so I would walk around the hospital, go into different storerooms, I would have to take
ferret about.
Yes. And I never came across, I was even surprised that the security services or the policemen trying to do the crowd control in front of the emergency department just carried truncheons.
So no sign at all of the fighters. And I think you were there when the notorious explosion happened. Can you tell people listening what it was like, what you experienced?
So I had moved to Al-Ahli Hospital that morning to start operating there. Ahli, which was also called the Baptist Hospital, is a British-built hospital that had treated British soldiers during the First World War. And when I got there, I had noticed how many internally displaced families were in the grounds of Al-Ahli, just like Shifa. By the evening, between cases, we heard an almighty screeching noise of a missile and then an explosion. The false ceiling fell but didn't injure me, and I had gone out of the operating room and saw that forecourt on fire. The fire had lit up the forecourt, and there were just bodies everywhere and parts of bodies everywhere. When I got to the emergency department, there were basically patients with shrapnel injuries, with amputations. There were dead bodies. And eventually, I had to move one of the patients that was injured, took him out through the forecourt. And even, carrying him through the forecourt. There's a forearm of an amputated child, and there are just bodies everywhere in that forecourt.
Utterly horrific. And you were working, obviously, throughout this period. We've heard lots and lots of stories of medical equipment being on the edge of failing because of lack of electricity and the lack of absolutely crucial medical supplies. Again, just tell me what it was like, because you're never sure what's true and what's propaganda. How difficult was it to operate? Were there times when incubators were actually going off, or were the hospitals able to keep them going with emergency generators? What was it like?
So, as the whole of the bed capacity of Gaza was 2,500, and you ended up with 35,000 wounded. And so we were running out of things on a daily basis. It became more and more difficult. Initially, it was antiseptic solution, and I went out and bought some washing up liquid and some vinegar to clean the wounds with. And then by the end, we had run out of anesthetic and ketamine, which is, a horrible veterinarian drug, but we are having to use it to
It's a horse tranquilizer, basically, yes.
And we were having to use it because it will allow you to put the patient to sleep without an anesthetist. But even at the end, the last few weeks, we were doing without it. There was no morphine. I was having to give paracetamol to patients after their surgeries as a pain relief. And we were doing dressing changes on children with no anesthetic and no analgesic. By the end, it turned into a kind of almost like a horror scene. And because I knew the history of Al-Ahli and the First World War history of Al-Ahli, it was as if at one stage I thought this place is stuck in time, that it's the same conditions that existed during these wars.
Or possibly worse.
Or worse.
Now, there is a ceasefire at the moment, or a truce, and we're 4 days in. It may go on for another 2 days. How important is that inside Gaza?
It's absolutely critical that the killing stops and the wounding stops, so that those who are there wounded get some treatment. But what's more important is that the hospitals are rehabilitated. I mean, there's tens of thousands of patients that need surgery, otherwise their wounds will be infected and they will die as a result of these wounds.
Now, you have lived and worked and watched suffering the people of Gaza, but of course Hamas did appalling things to Israeli people on the other side of that fence, terrible things, and any kind of ceasefire to work would have to be on both sides. Do you see any sign that Hamas would agree to a ceasefire?
I think the humanitarian catastrophe in Gaza means that people, at a minimum, there's around 5,000 buried under the rubble. People want just to bury their loved ones and then treat the wounded that are on a scale never seen before. The pressure for a ceasefire is there from the people who live in Gaza.
And I understand, I might be wrong about this, that you're going to be talking to Scotland Yard about the investigation of potential war crimes. Can you explain what the process is?
So my lawyer had been contacted by Scotland Yard to be interviewed as a British citizen who was the victim of a potential war crime, as a survivor of the attack on Al-Ahli Hospital, and as someone who had witnessed these wars, these attacks on civilians. And we will be interviewed, and hopefully, for me, Andrew, as a parent, if the world sweeps under the carpet the killing of 8,000 children in 40 days, the world that we will be living in is a frightening place. The sheer number of children who've been killed, there has to be some justice done for these children, and for us to be able to re-establish what has been established after the Second World War, which are agreed principles by which wars are conducted, where 8,000 children are not killed in 40 days.
And are you optimistic that Scotland Yard will open an investigation and that might lead in due course to some kind of justice?
I'm hopeful, and I'm forever hopeful. And as a doctor, my job is to advocate for my patients to receive the treatment that they have and the justice that they deserve.
And given what you've seen and what you've had to do, how do you feel about being back?
It's difficult. I'm glad to. I mean, I have to say, this is the one war that there were days that I didn't think that I was going to make it out. There were nights when I went to sleep and the bombing was so close to the hospital that I thought that was the end of us. I'm glad that I'm back. I'm glad that my kids are with me, but just overwhelmed by a sense of sadness for the patients that I wasn't able to help and the patients that I've had to help but still need more care. And
so a certain amount of inevitable guilt.
Absolutely. You know them and you remember them, and the way the way we're trained in this country, both in the medical schools and the NHS, there's a level of ownership that you have towards your patients when you come up the ranks from medical school to trainee doctor to consultant, that you never shake, and forever they will be my patients, and forever I will have a sense of responsibility to see them through.